Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. Before I start this presentation, let me introduce myself. My name is Afifa Zulfa Shalihati from class 1C. Today, I'd like to discuss about professional ethics and patient care. As you can see on the screen, I'm going to present three material. First, definition of radiologic technologies and code of ethics. Second, American Registry of Radiologic Technologies Code of Ethics. Third, Radiographer Code of Ethics from Indonesian Society of Radiographers. The radiologic technologist is an important member of the healthcare who is responsible in general for radiologic examination of patients. And the definition of Code of Ethics. Code of Ethics describes the rules of acceptable conduct toward patients and other healthcare team members, as well as personal actions and behavior as defined within the profession. And the next material is ARRT Code of Ethics, or American Registry of Radiologic Technologies Code of Ethics. The Code of Ethics forms the first part of the Standard of Ethics. Code of Ethics comprises of 10 principles. The first principle, the radiologic technologies acts in a professional manner, respond to patient needs, and supports colleagues and associates in providing quality patient care. Second, the radiologic technologies act to advance the principal objective of the profession to provide service to humanity with full respect for the for dignity of mankind. Third, the radiologic technologies deliver patients care and service unrestricted by the concern of personal attributes or the nature of disease or illness, and without discrimination on the basis of sex, race, religion, or socioeconomic status. 4. The radiology technologies practice technologies spawned upon theoretical knowledge and concepts, use equipment and accessories consistent with the purpose for which they were designed, and employs procedure and techniques appropriately. 5. The radiology technologies assesses situations, assesses care, distraction, and judgment, and acts in the best interest of the patient. 6. The radiologic technologies act as an agent through observation and communication to obtain pertinent information for the physician to aid in the diagnosis and treatment of the patient, and recognize that interpretation and diagnosis are outside the scope of practice for the profession. 7. The radiology technologies use equipment and accessories, employs techniques and procedures, perform service in accordance with an accepted standard of practice, and demonstrates expertise in minimizing radiation exposure to the patient, self, and other members of the healthcare team. 8. The radiologic technologies practice ethical conduct appropriate to the profession and protects the patient rights to quality radiologic technologies care. 9. The radiologic technologies respect confidence entrusted in the course of a professional practice, respect the patient rights to privacy, and reveals confidential information only as requested by law. 10. The radiologic technologies continually strives to improve knowledge and skills, sharing knowledge with colleagues, and investigating new aspects of professional practice. The third material I am going to present about Radiographer Code of Ethics from Indonesian Society of Radiographers of Paris. The Code of Ethics include 4 obligations, which is general obligation, obligation up to the profession, obligation to the patient, and obligation to self. The first obligation is general obligation. In this obligation includes three principles. One, it is not allowed to discriminate against the nationality, skin color, gender, religion, politics, and social status of the client. Two, always be guided by professional standards. Three, it is not allowed to do actions that are influenced by profit consideration personal. The second obligation is obligation to the profession. In this obligation include four principles. One, must maintain and uphold the good name of the profession. Two, only do radiograph at the request of a doctor without leave the procedure outline. Three, it is not allowed to ask other people who are not expert to do a radiograph. Four, radiological diagnosis is not allowed. The third obligation is obligation to the patient. In this obligation includes six principles. One, always keep the atmosphere or always keep the mood. Two, provide to the best service. Three, keep everything a secret. Obligation to keep everything that is known about the patient condition. Four, implement regulation and policies. 5. Carry out tasks quickly, precisely, and respectfully. 6. Must have a good working relationships between profession in the interest of service to the community. The fourth obligation is obligation to self. In this obligation includes two principles. One, must maintain health and safety. Two, always trying to improve his professional abilities both individually and together by following the development of science and technology. And for the conclusion of this material, the radiographer must complete and implement a code of ethics. Code of ethics used on international scale is ARRT or American Registry of Radiology Technologies of Code of Ethics. ARRT Code of Ethics include 10 principles. Indonesia has its own code of ethics that must be carried out by radiographer. There is four obligation from Paris. Thank you so much for the attention. Wassalamualaikum warahmatullahi wabarakatuh.